Every year, World Health Day is celebrated on the 7th of April, which is the anniversary of the creation of the World Health Organization. The theme changes every year, and this year it is on an extremely important theme, on aging and health, which is relevant not only to Japan, but to the entire world's population, and one that will grow very quickly, as you will see. Personally, we are very proud to be here in Japan, because it is the country with the world's largest proportion of citizens aged 65 and over, 23% in 2011, and has also the world's longest and healthiest life expectancy. Investing in good health throughout life improves the quality and longevity of our lives. Today we are witnessing a dramatic and unprecedented shift in global demographics. This shift affects all countries and poses challenges and opportunities to create healthy environments, to ensure that healthy lifestyles occur across all of the stages of one's life, particularly to ensure productive aging, and to design health and social policies that enable that. This year in 2011, the world's population hit a new threshold of 7 billion. At the same time, the world's population is getting older. It's doing so faster than ever before. This is a reflection on very welcome advances that have been made not only in public health, but in socioeconomic development in the last 50 years. Unlike past trends in development, now every country in the world is affected, including Japan, of course. And we are here today to share with you the global and the Japanese perspectives on this key issue, pressing issue. I'd like to share with you a few key facts. There is more information in a briefing paper in the back of the room that please take today. First, globally, the number of people aged 60 and over has doubled since 1980. Between 2000 and 2050, the number of people, the same number of people over 60, will more than triple to from 606 million to nearly 2 billion. Within the next 5 years, the number of adults 65 and over will outnumber children under the age of 5 for the first time in history. By 2050, these older adults will outnumber all children under the age of 14. Putting the issue into a global context, WHO notes that the majority of older people now live in low and middle income countries. By 2050, this proportion will increase to 80%. And my colleagues from the ministry and Professor Seiki will discuss more on the Japanese figures, I'm sure, in a moment. This aging affects us all, our families, our communities, our nations. And the implications of this now become quite critical here in 2012 as we look forward to 2050. So what are the strategies and the solutions for countries and communities to consider? Today, WHO is outlining a strategy centered around 4 approaches, some of which reach beyond the health systems. The first is to promote good health and healthy behaviors at all ages to prevent or delay the development of chronic diseases. The second is to minimize the consequences of chronic diseases through early detection of those diseases and to provide quality healthcare and social services. The third is to create physical and social environments, including our cities and our communities, that foster the health and the participation of older persons. And the fourth is to reinvent aging, is to rethink our own attitudes, our social attitudes, to facilitate the ongoing participation of older persons. And Japan has been a leader in designing and implementing many of these programs, which you will hear about. But many other countries are also copying those models, and they are also equally struggling with the same challenges and opportunities. And even here in Asia, we have China and Korea not far behind Japan. Aging and chronic diseases present certainly many health and social costs to governmental systems as well as to families and to communities themselves. And these approaches may on the surface seem costly for many of the programs, but the cost of not addressing the needs of the aging population, of not promoting a healthy and happy life course, are going to be much more significant. My full statement for time is available, and there's a bit more information which I encourage you to look at. In closing, just to note two items. One is that to recognize Japan's leadership globally, at the Executive Board of the World Health Assembly and the upcoming World Health Assembly, where all of the countries come together and pass resolutions, Japan has been leading a resolution on aging for the first time in many years. And secondly, our center in Kobe will be hosting an important event on aging, also in celebration of World Health Day in Kobe on April 7th, this Saturday, and again, material is in the back for your information. Thank you very much.